This recording of the lecture is designed to help you remember what it is you're supposed to learn to do in the class. We will go over this the first day of class. You do not need to watch it before class. And I suggest you think about watching it throughout the semester when you have questions about what you're doing and why you're doing it. So the purpose of this lecture is to talk about what grants and FOAs are. An FOA is a funding opportunity announcement. And in this class, you're going to be working with grants and FOAs. A funding opportunity announcement is a way for usually nonprofit organizations to get money to develop programming for specific populations. These funding opportunity announcements are based on national strategies, and these national strategies are typically found in Healthy People 2020. Healthy People 2020 was published around 2009, and it is the goals for health and wellness and health promotion that we should reach by the year 2020. In the very near future, they're going to publish Healthy People 2030, and those are the goals and activities and objectives that we should be striving to reach in the next 10 years. Also, these are based on those strategies, but they're a way to provide funding for organizations to develop new programming for communities in need. So that's what a funding opportunity announcement is, and that's what a grant is. When you write for an FOA or you write for a grant, you're writing to request money to develop programming. So I'd like you to think about, if I asked you for $500,000, I'd just walk up to you and go, hey, I need $500,000 for a program. What would you want to know before you gave me $500,000? In class, you'll be talking to peers, but let's just think about that. What would you want to know? I'll give you about 10 seconds to think. If I asked you for $500,000, these are probably the questions you would have. What's the need? Like, is there some need for this? Nationally, is there a need? What do you want to do? So if I want to develop a breast cancer program, what's the need? Do we really need that program? The next question you might ask is, well, where are you going to do this program? So what's the specific community in which you're going to work? What does your community think of it? Does your community want this program, or is it something you think they need and they don't want it? The next thing you might ask is, well, what theories are out there that support what you want to do? If you want to develop a breast cancer screening in Arizona, well, what programs exist out there that say this is a good idea? What has been done and what's worked or failed? So what are the theories that support what you do? And if there are programs that have run that are successful or have failed, do they support what you want to do? Then I think you would ask me to tell you exactly what strategies and activities I was going to use to make this program work. And you would probably want to know how I'm going to evaluate the program to make sure it's successful. And then I think you'd probably want to know exactly how am I going to spend that $500,000. Well, these questions that you would ask me if I asked you for $500,000 are basically what the government asks if you ask them for money. And those questions actually become the papers that you are going to write in this class. Your first paper will be a needs assessment, and that will be from you collecting national data on your topic and possibly a population that shows that there is a need in this area. So if I were conducting breast cancer programming, I would want to collect information that shows national data on breast cancer rates, survival rates, incidence, prevalence, and all of those sorts of things. The second paper you are going to write is called a community assessment. And in that paper, you're going to look at the national data, and then you're going one step down, and you're going to look at your community and the data for your community. So if you were talking about developing a breast cancer program and your community were going to be Baltimore City, you might want to know what the data say. Who gets breast cancer the most? Who dies from breast cancer the most? So in reality, white women get breast cancer at a far higher incidence rate than minority women. However, minority women die disproportionately to the population size. So based on that, you might want me to develop a program for minorities to see if I could get the women to get mammographies earlier so that they can get screened earlier, diagnosed earlier, and treated earlier, and that would all cause them to live longer. The third paper you're going to write is called Theories and Rationale, and in that paper, you're going to have to give me some rationale for why you need this money. What theories support your ideas? What are other communities doing? What are other programs? And so you're actually going to have to argue your point with objective, factual data to show that your program is worthy of this money. The fourth paper you write is called Implementation and Evaluation, and in that paper, you have to tell me exactly what's going to happen. What are the goals and objectives? What are all the activities and strategies you're going to do? And how are you going to evaluate your program to show it was successful? Basically, you're telling me who's doing what, by when, and how. And then how will you evaluate? And the last paper you write is a budget. And your budget has almost no narrative. It's almost all numbers. And in that budget, you have to detail how you're going to spend all the money that you are requesting from the government. So those questions that you would want to know if someone asked you for $500,000 are the same questions that the government wants to know when you ask them for money. And those questions then become the papers that you will write in this class. Near the end of April, you will take all of these papers that you've written, put them together, and write the grant. And you will submit your grant to me for grading. So most of the grants have a maximum of 20 to 25 single-spaced pages, 1-inch margins, 12-point font. And you all are going to probably say when it comes time to turn in your grant, you're going to be Charlie Brown at the bottom of the page freaking out because you're going to want more pages than 20 to 25 single-spaced pages. You're actually going to want to write more than that because you have so much to say. And I know at this point in the semester you don't believe that, but by the time the end of the semester gets here, you're going to see that it's going to be very difficult for you to write only 20 pages single-spaced. So keep that in mind, but all these papers that you're writing all semester get put together to make that 20 to 25 page document. So in order to learn how to write a grant or to learn to write for Health and Human Services field, you need to learn a new writing style, and that writing style is called technical writing. In technical writing, there's no fluff. It's just factual information. I don't want to hear a bunch of extra stuff and your emotions and words that make it seem important. In technical writing, you're reporting factual information. That means it has to be succinct. You need to say it in as few words as possible. It needs to be accurate, so what you tell me has to be factual. It can't be what you think. It has to be what the data tell us. It has to be accurate, which I just said. It has to be compelling and persuasive because you're asking the government for hundreds of thousands of dollars. Whatever it is you're writing, it has to be compelling, it has to show there's a need, and it has to be persuasive in order for them to want to give you the money. And lastly, what you're going to see throughout the semester on all kinds of documents, and you will hear me say it often, is you must be thorough, accurate, and succinct. And those are words that you will learn by the end of the semester. Everything you write, you have to be thorough, accurate, and succinct. And that means you need to say as much as possible in as few words as possible. So what does that mean? I'm going to go through some examples. You can read along with me. On the left-hand side is something that is not technical writing. The large disparity is troubling as it shows a political bias. It is totally unacceptable that poor people do not have access to the same quality of health care as others. This must be stopped. That's not technical writing. Here's the same statement written more objectively. Disparity continues in relation to access to quality health care. Race, ethnicity, educational level, socioeconomic status, and sex all contribute to the existing disparities. It's very factual. Next example. On the left, something not technical. Poor women cannot afford food for their families, medicine for their children, or heat for their homes. The continued efforts of some politicians to maintain this inequity is immoral and inexcusable. You're politicizing, you're editorializing, and that's not what technical writing is. Here's the same statement that's written more objectively. Women and their children who live in poverty are often faced with lack of funds to maintain daily functions, food, medicine, and heat. Poverty is a major contributor to lack of quality health care for this population. Again, very objective. The next one. The mayor's illustrious career came to an abrupt end when he was caught carousing with unsavory characters, with many fitting into the realm of hookers, pimps, and known drug dealers. That's got a lot of emotionally engaged words like illustrious and carousing. Here's the same statement that's more objective. The mayor's career ended abruptly after his continued relationships with hookers, pimps, and drug dealers put his judgment into question. Next example. The heroin epidemic has continued to grow at unacceptable rates. It is killing young and old, rich and poor, black and white. Its addictive powers that take over people's minds and bodies, leaving them helpless shells that need constant fixes of the drug merely to exist. There are a lot of emotional words in there like unacceptable, killing, powers, helpless. These are all words that should not be used in technical writing. Here's the same statement. The heroin epidemic has continued to grow in all parts of society. The increase in overdose deaths is documented through the weekly MMWR reports from the Centers for Disease Control. There's no emotional words in that statement. So all of that's important because you're going to learn how to write, but here's the next thing that's important. You're going to be choosing a grant, and the next time we meet, you will be writing an essay where you will be explaining what grant you want for this class. You are going to be working with this topic throughout the entire semester. So it is critical that first you like the topic. Choose a topic that you like. There are a variety of topics in the choices. Make sure you know who the audience is in the grant. Oftentimes people do not pay attention to this. If the grant says you need to train healthcare providers and that's exciting to you, then that might be a grant you want to choose. But if the grant says you have to train healthcare providers and you want to train the teenagers, that's not going to work. You have to write exactly what the grant says. Make sure you're interested in developing what they're going to tell you to develop. Sometimes it's programming, sometimes it's policy. So make sure you really understand what they want you to do. And make sure you're looking at whether or not it's community or individual programming. Most of the grants require community programming because it's become very clear. If you create a program for individuals and you do not address their environmental setting or their community, when the grant ends, the people go back to the negative health behaviors that they had before the program. So most of the grants will actually be asking you to look at a variety of aspects of your community and not just the individual people. The other thing that we're going to be working on throughout the semester is the NIH standards, and that's the National Institute of Health Standards. At the end of the semester, you're going to be presenting your grants online. These are the standards that are used to measure whether or not grants are appropriate or are fundable. Significance, is this going to make a difference? The investigator, who is the investigator? So as you're writing the grant, you need to decide what organization you are. Innovation, they want to know, is there anything in your grant that's innovative? Is there anything new and exciting? The approach, they want to know if the approach has been proven to work or there are theories behind what you're doing that have been proven to be effective. And lastly, they want to know that the environment in which you're doing the grant is going to make it successful. So significance, just to go over each one, this is what each one means. They want to know the impact. They want to know what the need is, how large the need is, and how many people you will service. So if you ask for 500,000 people and you're going to service 20 people, that's a lot of money per person. But if you ask for 500,000 people and you're going to service 100 people, that means that the money will go further. And so they're going to be looking at impact for investment. The next one is the investigator, and they want to know who's running the program. So if I were writing that grant for breast cancer prevention and I my organization was the Lung Association, that doesn't make any sense. But if I were writing a grant for program breast cancer prevention, and I belong to Hopkins, or I belong to the Cancer Society, or I was part of a Baltimore City or Baltimore County Health Department, that makes sense because those organizations would be able to run the program. The next one is innovative, and they want to know what's new and exciting and what are you doing in your program that's based on current research that means it's going to be successful. So they want to see creativity. They want to see new, exciting items. The next item is the approach. They want to know that what you're doing is well-reasoned, it makes sense, it's logical, and it's going to work. That there's actually research that indicates that this type of program could work because you're pulling from other programs that have been successful. They want to know the environment. Will it add to the field? So what's the environment in which this is happening? Am I going to run my breast cancer program at work sites, or am I going to run it in the community? Am I going to run it at the health department? And they want to know that when this ends, that what you do will actually add value to the environment for this disease or condition. So when I finish my grant, will what I have completed add to the environment that researches breast cancer or for programming for breast cancer? So these are the standards again. We'll go over them a couple times throughout the semester. But at the end, your grant will be graded based on grant standards, but then your presentation will be graded on NIH standards. That concludes the slides for this lecture. Again, they're designed to help you review throughout the semester so you can review what it is we're doing and why we're doing it.